think that I'm done tripping. I'm tripping. I've been sipping, that's how I control this feeling. You keep giving, you keep on getting it. Ooh, oh. Maybe it's your love, it's too good to be true. Baby boy, your love got me tripping on you. You know your love is big enough, made me trip up on you. Yeah, it's big enough, got me tripping on you. Tripping on you. My bad for tripping.
Okay, so hi guys, my name is Karil Stephanie P. Placerda from EP13. So before I start my vlog, I would like to apologize for having this weird facial expressions and weird teeth because actually this year I will be going to my dentist for the appointment for this, but sadly because of COVID-19 we cannot travel, and also because I'm underage, because I'm not yet 21, I'm only 19. I cannot travel outside our barangay or even to our municipality because nga of the age restriction. Okay, so please bear with this ugly face along this video. So let's start. Okay, so before we start, let's first define what is COVID-19. Okay, so COVID-19 means coronavirus disease 2019. Okay, so this virus emerged in Wuhan City, China, and it affected 70 countries, including us, the Philippines. And of course, earlier December 2019, the Chinese people are experiencing the symptoms of the said virus, but they just declared it or announced it an outbreak on December 31 to the WHO, or the World Health Organization. And according to WHO, the said virus can trigger respiratory infection, and it can affect the upper respiratory tract, which are the sinuses, nose, and throat, and our lower respiratory tract, the windpipe, and our lungs. Okay, and this virus spreads the same way other coronaviruses do, mainly through person to person contact. And we have two previous coronaviruses outbreaks. First, we have the known severe illness caused by a coronavirus emerged with the 2003 SARS, which means the severe acute respiratory syndrome in China also. It's an epidemic in China. And the second one is the MERS. It came from the Saudi Arabia. It is an outbreak in Saudi Arabia. That's why it's called MERS, because it means Middle East Respiratory Syndrome. Okay, so yeah, before this coronavirus disease pandemic, there are previous coronavirus diseases that happened. What are the symptoms of COVID-19? So the main symptoms include fever, coughing, shortness of breath, trouble of breathing, fatigue, chills, sometimes with shaking, body aches, headache, sore throat, loss of smell or taste, nausea, or diarrhea. And of course, this virus can lead to pneumonia, respiratory failure, septic shock, and death. And many COVID-19 complications may be caused by a condition known as cytokine release syndrome or cytokine storm. This is when an infection triggers your immune system to flood your bloodstream with inflammatory proteins called cytokines that they can kill tissues and damage your organs. According to researchers in China, these were the most common symptoms among the people who had COVID-19. Fever 99%, fatigue 70%, cough 59%, lack of appetite 40%, body aches 35%, shortness of breath 31%, mucus or phlegm 27%, okay? So some people who are hospitalized for COVID-19 have also have dangerous blood clots, including in their legs, lungs, and arteries. What to do if you think you have it? If you live in or have traveled to an area where COVID-19 is spreading, if you don't feel well, stay home. Call the doctor if you have trouble breathing. Follow your doctor's advice and keep up with the news on COVID-19. What are the causes of coronavirus? Researchers aren't sure what caused it. There's more than one type of coronaviruses. They're common in people and in animals, including bats, camels, cats, and cattle. SARS-CoV-2 or Severe Acute Respiratory Syndrome's coronavirus 2, the virus that causes COVID-19 is similar to MERS and SARS, and they all came from bats. So the issue about this, meron daw issue na yung COVID-19 is planado. Like, it is something like nuclear weapon na ginawa ng Chinese people na kaya daw madali itong kumalat kasi nga planted bomb, sabi nila. But the researchers or the scientists have declared na hindi siya made in laboratory, na wala siyang elements from a lab. Kasi when they investigated the virus, the researchers have examined it na hindi nga siya gawa. It came naturally from an animal. Hindi siya planted or hindi siya weapon. It is natural pandemic talaga. Hindi siya gawa. Okay, so yeah, fake news yung mga naririnig natin na issues about doon. Coronavirus risk factors. So, yung mga madaling maanohan ng virus, makakuha ng virus is yung mga bata at matatanda. Especially yung mga taong over 65 years old. Kasi nga, they're the ones na marami ng nararamdaman sa katawan. Kaya they're more prone to illness or they're more prone to this virus. And also their immune system are very low to protect themselves or their health from the said virus. Okay, so these are the medical condition na madaling kapitan ng virus. The ones with high blood pressure, heart disease, lung disease, asthma, kidney disease that needs dialysis, obesity, diabetes, cancer treatment, especially chemotherapy, liver disease, and cigarette smoke. You can also get the virus from touching surface, like when you touch your mouth or nose, possibly your eyes. Most virus can live for several hours on a surface that they land on. A study shows that SARS-CoV-2 can last for several hours in various types of surfaces. Like for example, on copper, it lasts for 4 hours. On cardboard, it lasts up to 24 hours. And in plastic or stainless steel, it lasts for 2 to 3 days. So yeah, we should really be careful of what we touched, especially when we go out, because we don't know that that object has been touched with a person who is infected or is a carrier rather. Okay, so yeah, before we go out, we should prepare on what we bring. Especially, we should bring alcohol or sanitizers so we can at least be prevented to that virus. I'm gonna share to you the ways to prevent coronavirus. First, wash your hands, often with soap and water, or clean them with alcohol-based sanitizer. Second, practice social distancing. You know the 6-meter rule? That's social distancing. And cover your nose and mouth in public. Of course, for you not to spread the virus inside your body, you have to avoid sneezing or coughing without a cover. Okay, so yeah, and also don't touch your face, especially when you are, when you came out, when you came from outside your house, or when you came from a public place. Don't go home touching your face. Okay, you should have a sanitizer or alcohol along with you inside your bag. And lastly, clean and disinfect. Okay, you clean first with soap and water, but disinfect surfaces you touch often, like tables, doorknobs, light switches, toilets, faucets, and sinks. How can you help to stop the spread of the coronavirus? Okay, so first we have the social distancing or physical distancing. Keeping space between yourself and other people where you have to go out. Second, quarantine. Keeping someone home and separated from other people if they might have been exposed to the virus. And third, lastly, isolation. Keeping sick people away from the healthy people, including using a separate sick bedroom and bathroom when possible. And yeah, keep safe, guys. Stay at home and save lives. Okay, so thank you for watching and have a good day. God bless us all. And yeah, padayon lang ta. Limbasog ta, guys. Bye-bye!